Hello, everyone. I hope you are taking care of yourself and are staying indoors. Today, we will be evaluating the current measures implemented by the government and the effectiveness against curbing the spread of COVID-19. Through this presentation, you would get an insight about why there is a need to follow the public health guidelines and why current measures implemented by the government needs to be changed immediately in order to combat the spread of COVID-19. Uh, the data that we got was from a website known as visualcapitalist.com. Data that we got were comprised of a number of confirmed COVID-19 cases per million population and the number of tests conducted across various countries. Since our focus is to evaluate the cases originating in Canada, our supporting visuals will be based on Canada and in North America in general for comparison. The tool that we use for gaining the insight and understanding the data was Power BI, which is a very powerful tool to understand the data. Moving forward, so the question that arises is, why do people need to follow public health guidelines? So the guidelines provided by the public health are designed to protect individuals which are vulnerable to contracting the COVID-19 virus. Uh, if those measures are not followed, then you would have a situation where the number of cases, as you can see in purple, would peak in a very small time frame. Due to this, the number of the lives of the people who are already infected will be in grave dangers because the entire healthcare system would collapse because of the uh, numerous cases that they would be handling at one time. On the other hand, if you see if the measures like social distancing are enforced strictly throughout the country, then the rate of spread uh, across a longer time frame would stabilize. In that case, people who are infected will get uh, adequate treatment so that they can uh, be treated uh, and can be discharged as soon as possible. The current measures, uh, as we know it, needs to be changed. And in order to curb the spread of virus by implementing stricter measures uh, and also modifying the current and existing measures which are in place already. So the question arises why the current measures needs to be changed. Firstly, I would say there's a lack of seriousness uh, and urgency amongst the general population to follow social distancing, as people still go out in groups and are constantly in close proximity with people, which they shouldn't be doing. Secondly, the number of confirmed COVID-19 cases across Canada is on the rise, as you would see in the next visual. And even after uh, the mandate provided by the Canadian government to implement social distancing and the closure of all the non-essential services, people are there's still a significant rise of confirmed COVID-19 cases across Canada. Thirdly, the number of tests conducted by the Canadian government is very less. There should be more testing happening so that people who have the virus, who are infected, should be isolated as soon as possible, so that we can curb the spread of the virus. The only way we can do is to just uh, increase the number of testing across the country, so that the more people who are tested positive should be put into isolation, and the the population which are not infected should be safeguarded. As you can see in the visual, the number of COVID-19 cases across Canada are on the rise, and if after a few days or few weeks, you would see the trajectory would be as similar as you can see in US. Unless or until the changes to the current measures are made, it is highly likely that the number of COVID-19 cases will also be as similar to what we are seeing right now in the US. Uh, Here you can see that the total number of confirmed COVID-19 cases per million population is very high. As of April 14, that's where the data is till now, is around 680 as compared to uh, 1,760 in US. As compared to US, Canada is doing considerably well, but then there's still uh, there's need to be some sort of change that should be happening in the measure so that the curve should can become a little more flat. Uh, this visual tells us the total cumulative test that has been done across Canada, which is till date is very less, which is almost close to 500,000, maybe less than that. As compared to US, it's almost is around 3 million, which is still less. But then in Canada, there is a need to increase the number of testing uh, across the provinces and cities so that the government can isolate the people who have contracted the virus and isolate them. Uh, Moving forward, one of the recommendations that I would suggest would be to enforce even stricter physical distancing measures by first deploying the police to patrol the streets and finding those who don't comply. And second, uh, you have to create awareness about how social distancing is the only way to stop the spread of this virus, which is very, very fatal. Secondly, uh, uh, we should be taking the help of the military to build field hospitals so that we can number of speed up the number of tests across all the population and treat the patients who are infected. Thirdly, which is a very strict recommendation, but then it has to be followed, is that provinces which have been highly hit, which have seen a surge of cases in last few weeks, we need to enforce a strict and complete lockdown of the provinces so that the movement of people can be curtailed. And when it's done, uh, you will see a slowdown in the number of confirmed cases across the country. The only way to do it is to have a complete lockdown of the provinces for maybe a few weeks or maybe a month. In conclusion, I would say the current measures adopted by the government are not helping to bring down the number of cases across Canada, and therefore there is a need to change the measures outlined by the government and implementing measures like stricter enforcing of social distancing and by setting up field hospitals with the help of the military to speed up the process of testing and test the patients and treat the patients who have been infected. Unless or until, in my opinion, the recommendations that have not been adopted, there is a need to adopt those strict measures. And unless or until those recommendations are not implemented, the number of cases will continue to rise. Thank you.